In a startling development, news from Maryland has confirmed the first U.S. human case of New World Screwworm, a parasite that was once believed to be eliminated from the country. This case has sent shockwaves through the medical and public health communities, as the screwworm was thought to be a threat of the past, not something that would resurface in modern times. Decades ago, extensive eradication campaigns and public health efforts led to the successful removal of this dangerous parasite from the United States. The return of the screwworm is a sobering reminder that even diseases we believe to be gone can reappear, especially in our increasingly connected world. The New World Screwworm is a flesh-eating parasite that can cause devastating wounds in both humans and animals. Its larvae burrow into living tissue, leading to severe pain, infection, and, if left untreated, potentially life-threatening complications. The impact on livestock and pets can also be catastrophic, threatening animal health and agricultural livelihoods. In response, health officials are working tirelessly to investigate the source of the infection and to ensure that this remains an isolated incident. Their efforts include tracing possible routes of exposure, monitoring for additional cases, and coordinating with national and international health agencies. This case highlights the critical importance of global travel awareness and public health vigilance. As people and goods move rapidly across borders, so too can parasites and diseases, making it essential for travelers to be informed and for health systems to remain alert. Fortunately, the patient received prompt medical care and has made a full recovery. This outcome not only brings relief to the individual and their family, but also provides a valuable learning opportunity for medical professionals who can now better recognize and treat such rare infections. This event underscores the need for doctors to always consider a patient's travel history when making a diagnosis, especially when symptoms are unusual or unexplained. Early detection and awareness can make all the difference in preventing the spread of rare diseases. The Maryland case has prompted renewed focus on strengthening our defenses against rare parasitic diseases. It has also encouraged collaboration between local, state, and federal health agencies to improve surveillance and response strategies. Ultimately, this incident serves as a powerful reminder of the interconnectedness of global health threats. No country is immune, and international cooperation is vital to detect, contain, and prevent the spread of emerging diseases. As we move forward, vigilance and preparedness remain our strongest tools in preventing future outbreaks and protecting the health of both people and animals across the globe. The New World Screwworm is the larval stage of a parasitic fly known as Cochleomya hominivirax, a species infamous for its destructive impact on both animals and, in rare cases, humans. Unlike most maggots that feed on dead tissue, screwworm larvae are unique because they consume living flesh, making them especially dangerous. These larvae are notorious for infesting open wounds, burrowing deeper into healthy tissue as they feed, and causing immense pain and distress to their hosts. Female screwworm flies are drawn to even the smallest cuts or abrasions, where they lay hundreds of eggs. Within hours, these eggs hatch into larvae that immediately begin feeding, rapidly worsening the wound. The larvae's relentless feeding causes wounds to expand, often becoming infected and attracting more flies, which can lead to a vicious cycle of infestation. Screwworms primarily target livestock such as cattle, sheep, and goats, but they can also infest pets and, on rare occasions, humans, especially those living in rural or agricultural areas. If left untreated, infestations can lead to severe tissue destruction, secondary infections, and even death, making early detection and treatment absolutely vital for survival. The screwworm's aggressive nature and rapid spread have made it a major threat throughout the Western Hemisphere, particularly in regions with large livestock populations. While human cases are rare, they are extremely serious, especially for individuals with untreated wounds or compromised health, and require immediate medical attention. For farmers and ranchers, screwworm infestations can be economically devastating, leading to loss of livestock, increased veterinary costs, and significant financial hardship. Raising awareness, practicing good wound care, and seeking prompt veterinary or medical intervention are crucial steps in managing and preventing the spread of this dangerous parasite. The Maryland screwworm case was ultimately traced back to recent travel from El Salvador, a country in Central America. The patient had returned to the U.S. after spending time in an area where the screwworm outbreak was actively spreading, unknowingly carrying the infection with them. At the time, El Salvador was experiencing a significant outbreak, with local health authorities working tirelessly to contain the spread. The region had seen a surge in cases, prompting international concern and increased monitoring by global health organizations. The infection was acquired abroad, not within the United States, which meant there was no evidence of a local screwworm population. This distinction was crucial for public health officials, as it indicated the risk of a domestic outbreak was minimal. After a thorough investigation, health officials confirmed there was no local transmission. They conducted detailed interviews, traced contacts, and examined the environment to ensure the infection had not spread within the community. The ongoing outbreak in Central America, however, continues to increase the risk of imported cases. Travelers returning from affected regions must remain vigilant and report any symptoms promptly to prevent further incidents. The Maryland case serves as a powerful reminder of the importance of monitoring global health crises. Rapid communication and international cooperation are essential to detect and respond to emerging threats. Fortunately, the patient received prompt medical attention before the screwworm larvae could mature, effectively preventing any further spread of the parasite and protecting the wider community. This swift containment highlights the effectiveness of the U.S. health system, showcasing the dedication and preparedness of medical professionals and public health teams in responding to imported infections. While the risk to the general public remains low, ongoing vigilance is essential. Public health advisories and community awareness play a key role in preventing future outbreaks. Imported diseases like screwworm require robust and coordinated health responses to prevent community spread and safeguard public health for everyone. The New World Screwworm was eradicated in the U.S. by the 1960s through the sterile insect technique. This method involved releasing sterilized male flies to collapse the population. A biological barrier in Panama has prevented northward migration for decades. Recent outbreaks in Central America pose a modern threat. The Florida Keys outbreak in 2016 was swiftly contained, showing ongoing risk. The shifting northern boundary of the parasite requires continued vigilance. The risk of re-establishment in the U.S. is low, but imported cases remain a concern. The Maryland case poses minimal risk to public and animal health. Health officials are monitoring Central American outbreaks and advising vigilance. Doctors and veterinarians are urged to consider travel history and diagnoses. Travelers to affected regions should take precautions to prevent infection. Simple steps like cleaning wounds and seeking prompt medical attention are key. The case highlights the success of U.S. health systems in containing threats. Public awareness and global health surveillance are crucial for safety. The key takeaway is to stay informed and take preventive measures. Vigilance ensures protection against rare imported health threats.